Good morning. Good morning, Minorities for Medical Marijuana family. How y'all doing today? How y'all doing? Good morning. Good morning. I am your moderator, Nicole Buffong, calling in from Las Vegas, Nevada. We also have our lovely co-host on today, Mr. Stanley Atkins. We're just here to welcome you all to our Tuesday episode of Health is Wellness Week. Good morning to everyone. We're going to give everybody a few minutes to get in here because we've got a lot to cover today. Today is our Lupus Day. We are so excited. We have the lovely Dr. Denise Vadeau on as our guest. But first, I really wanted to thank everybody that joined us yesterday for our Sickle Cell talk. We had a great talk with our founder, Ms. Roz McCarthy, and our director of medicine, Dr. Joseph Rosado. We had a great talk about sickle cell. If you guys missed it, you can catch the replay on our LinkedIn, Facebook, and YouTube channels. Today, we are really kicking off autoimmune because, like we mentioned yesterday, sickle cell is a genetic disease, not an autoimmune. But I wanted to kind of get started with what is an autoimmune disorder. A lot of people don't really know. They might know that this disease is categorized as an autoimmune or that disease, but what does it actually mean? And through our research, I have learned that autoimmune diseases are a family of more than 80 chronic and often disabling illnesses, broadly characterized by immune system dysfunction, leading to the loss of tolerance to self-antigens, presence of increased level of autoantibodies, inflammatory and mediatory cells, resulting in chronic inflammation. Remember that word. All of that, everything that I said, all the medical jargon, equates to increased chronic inflammation, which usually leads to the pain that most of these autoimmune disorders and people diagnosed with these diseases are feeling. When a person's immune system attacks their own body, that's literally what autoimmune means. The immune system is designed to target viruses and other pathogens, and it usually can tell the difference between a foreign invader and your own cells. However, when it sees healthy cells as foreign invaders, it launches a war against your body. It sounds terrible. Sending out antibodies to attack healthy tissue like joints, organs, or skin. If you all want more information about this, I did get this from our National Library of Medicine at the National Center for Biotechnology. But I know my co-host, hey, Mr. Atkins, how you doing today, sir?
Good morning.
Good morning. Good morning. Good morning. I know Mr. Atkins, I know the Cannabis has a much easier way of explaining what an autoimmune disease is for our folks, for our people who did not go to medical school or can't read research papers from the National Library of Medicine. So can you give us a breakdown of what an autoimmune disease is in your terms?
Yes, autoimmune diseases are diseases that affect our immune system. They are autonomous. And a simple explanation for lupus, I know there's a lot of key terms, a lot of words about this long that people get intimidated by. Lupus is a disease that's caused when the body attacks itself. That is a simple explanation. The different inflammatory responses, your body that's normally built to defend itself, it chooses to attack itself. And as Nicole mentioned, it can attack a variety of our organs. It can hit different body processes from your eyes to our liver, our kidneys, even our reproductive organs. And for many who may not know, what is the largest organ in our body or on our body? Skin. You've got more skin than you have anything. So that's one of the common places where we find lupus and what patients will call flare-ups. A lot of times they'll find it in the creases of the skin, like where skin on skin contact. So it'll be here, around the creases of the eyes, around the ears, around the bottom crease of the buttock, or even sometimes along their waistline, or many people would consider their bikini line. When it comes to lupus, it's not like any other disease process. I know Nicole and I went live on Instagram this morning to really just touch on this, ladies and gentlemen, but to really give you an idea of it. So lupus oftentimes is abbreviated SLE. And people see the SLE, and the reason we put SLE in the medical field is because that stands for systemic lupus erythematosus. I think it's a lot easier just to say lupus for people.
Yes, I wasn't going to try to say that word. I found that. Yes, yeah, but these are you're touching on the 3 different types of lupus. But before we get there, because we have a lot to cover with lupus in particular, I just wanted to kind of go back to our autoimmune disorders in general, right? Because that's what we're going to be talking about for the rest of the week. And yes, we are focusing on lupus today, my folks, but I want you to kind of understand that lupus is one of many autoimmune disorders, right? At over 80 million different kinds, or 80 different kinds that have been actually discovered so far. But autoimmune disorders affect about 23 million people just here in the United States. Just to give you an idea, that's only about, 13 million people suffer from cancer, all the different types of cancer, right? So that's a large pool of people that are usually often misdiagnosed, right, Stanley? Especially
Absolutely.
Research that we found, especially with lupus. It usually takes how long before you can get an actual diagnosis?
Usually between the average patient, usually between 3 and 7 years for a accurate diagnosis. I actually sent some messages on Facebook this morning to some close friends that I personally know that have lupus. And one, she said that she had been suffering for about 5 years before she got an accurate diagnosis. And the reason for that, ladies and gentlemen, is because lupus is such a very unique disease process, because it can present itself in so many different ways that it's actually difficult for you to get a diagnosis. So please remember, people, when people like Nicole, myself, when you go see one doctor, it is okay to get a second opinion, because sometimes with autoimmune disease, you have to get a second, third, fourth, or even fifth opinion before they can actually find out what's going on with you.
What's going on, right? Because it says, because of its complexity, right? Most patients often endure lifelong debilitating symptoms, loss of organ function, reduced productivity at work, high medical expenses, because if it takes you 3 years just to figure out what's going on, then you're getting misdiagnosed, you're getting mistreated. And so then you're having the negative side effects, because you were talking about the different types of lupus. Excuse me. So an estimated 5 million people worldwide live with lupus. But although the number of men with lupus has increased, women between the ages of 15 and 45 continue to make up about 90%. That's a lot. Of those 5 million people. And if it's taking those women 3 to 7 years to actually get the right diagnosis, there's probably plenty of people out there that were not even accounted for when this number was done, that do have lupus and don't know it and are still being mistreated or misdiagnosed. And then it's the fact that an interesting fact that I found about lupus as well is that people of color are diagnosed at 2 to 3 times the rate of white people. Yes. So that's an interesting fact as well. And so going back to your 3 different types of lupus, right? Okay, so I understand you have the systemic lupus, right? That's the one that you mentioned. And then you have the discoid lupus, which only affects the skin and has no other organ complications. And then this was interesting, the drug-induced lupus, caused by taking a triggering medication. So you're saying that there are synthetic drugs approved by the FDA, that are on the marketplace.
Yes.
They already know causes people to have symptoms of lupus or to contract lupus.
Yes.
Okay.
So this is what we have to understand about pharmacology and pharmaceuticals. Yes, drugs are designed to treat a specific disease process, but as we discussed yesterday, they give you one medication to treat one disease process, but the adverse effect of that drug, as you see in some of the commercials, this drug may cause blank, blank, dry eyes, nose, mouth, problem sleeping. So then oftentimes you have to take a secondary medication to mitigate the problem caused by the other medication. And when it comes to autoimmune disorders, this initially is very difficult to even get correct for the correct medications, but also for the patients, because many times you treated one problem, but you caused another problem. So yes, there are medications in the world that can lead to disease processes. Oftentimes, one of the most common ways that we see this is in gastrointestinal patients with what we call broad spectrum antibiotics. I know we're not going to get into that, but people who have a systemic infection that nothing's relieving it, they have certain types of antibiotics that can actually kill everything in the body. But the problem is it kills the good bacteria in your body sometimes, leading to disease processes in the stomach. A common case is C. diff, which is Clostridium difficile, seen in nursing homes from antibiotics.
Okay, so all right, so I understand better now that there are a few different types of lupus and things that can cause lupus and lupus reactions in the body. And one of the things that I also discovered was there is no known cause, but it is difficult to diagnose. We discussed that because the symptoms are so similar to other diseases and diagnoses. But there's an anti-nuclear antibody test, ANA, and evaluation of the symptoms. But this test, people with lupus are positive for the ANA test. And then symptom evaluation helps to really diagnose what kind it is, whether it was the drug-induced or discoid or systemic. And so I wanted to read what is the statement on the Lupus Foundation of America. This is their statement regarding medical marijuana. The Lupus Foundation of America supports further scientific research on the use of cannabis and its derivatives, medical marijuana in parentheses, for treating and alleviating the symptoms of lupus. Research conducted to date has shown that cannabinoids may be somewhat effective in treating pain from arthritis and related conditions. But other research has also suggested potential adverse effects and interactions with medications. Further scientific research on its effects for people with lupus is needed to provide evidence regarding its safety and effectiveness. We strongly recommend that those with lupus engage their doctors in a frank conversation about the use of cannabis and its derivatives before considering use for lupus. So it looks like the Lupus Foundation of America has not been introduced to our guests that we're going to have coming up here. There are plenty of patients and examples and research that we know of, just me and you personally, of people that have used cannabis and been successful using cannabis to help treat lupus or the symptoms of lupus, to help manage, to help manage the symptoms of lupus, right?
Yes.
Better than any narcotic or any other synthetic pharmaceutical drug that they were given. I mean, it might be a combination. It might be, they using some sort of synthetic medication along with cannabis and reducing the use of opioids or steroids or other things that are given to lupus patients. And so I'm really excited to have our guest on, Dr. Denise Vadeau. I think that we are waiting for her in the backstage, but she should be joining us shortly. But, like we said, you can tell us a little bit about your experience, Stanley, with lupus and individuals that are using cannabis to help manage their symptoms.
Absolutely. I was recently speaking to a close family friend that I've known almost my entire life. She got a recent diagnosis of lupus, and hers affects the skin and the bones with the most for her. And she was finding like the rashes, the inflammation, and she sent me some pictures. And it really hit home because many of these patients, not only does it affect them physically, it affects them mentally, especially women, because vanity is still a thing in the world. We worry about our looks. We want to make sure that we look and feel our best. Many of these patients have inflammation around their necks, around their eyes, their face, their hands, and many times it can become debilitating. And what they found was that some of these patients, they're new to the concept of medical cannabis. So many of them have jobs that don't allow them to consume. They may not be in a state that they can consume safely. And they found out that sometimes that consuming via inhalation didn't really help them. But what helped them was a topical. Sometimes whether it's CBD, THC, along with organic organic compounds such as turmeric, ginger, different types of pepper. So there are some formulations out there that some patients did their own research. I tell people, like we said yesterday, you are your number one advocate. So you have to be an advocate. And we also have to understand many times that lupus, there is no cure for lupus.
Right.
Back to the what Nicole just read to us, they say it may. They're not making medical claims saying, hey, you take this and your lupus will just go away. No, but medical cannabis may potentially be a safe alternative to make the signs and symptoms manageable for patients.
That's
so
right.
We're not saying, hey, you smoke some cannabis and your lupus goes away. No, but it may make your symptoms a little more manageable, which may improve your quality of life.
Absolutely. And I'm so excited to bring in our guest, Dr. Denise Vadeau, joining us from beautiful sunny Miami, Florida. Hi, she is a lupus warrior. And so I want her to tell us a little bit about her story, her journey, that I've learned so much about since I met her earlier this year. And you really are a shining example, especially with the work that you do. And we'll get into that a little bit later. But first, talk to us, and thank you for being here today, Dr. Denise. Talk to us a little bit about your personal journey to learning how you got diagnosed with lupus, and then learning tell us a little bit about what you did to manage your symptoms the best.
Well, grand rising and good afternoon to those who are not in the morning hours. It's so good to be here. And Nicole, I feel like we're becoming regulars, seeing each other. I appreciate that. I especially appreciate the opportunity to communicate and share a little bit of my story. I don't really talk about this often, especially because of the research that I do, but I felt this was a great platform to say hello and to talk about the story. So as first, I'm very happy that you guys are also talking about lupus, because I feel like lupus is a disease that doesn't get talked about that often. There's so many diseases that are important, but lupus is certainly one. And it's kind of a silent killer, which is what really it leads to my story. So I am a cannabis. So for those of you who don't know me, hello. I am Denise Vadeau, Dr. Denise Vadeau. I am a cannabis epidemiologist at the University of Miami. I have faculty appointments at the School of Nursing and Health Studies and also in the School of Medicine. And what I do every day is I find data, I conduct studies, I collect data, I analyze data, I disseminate data showing how cannabis can influence human health. And I do that in many disease outcomes, not just cardiovascular. Cardiovascular is what I'm the most passionate about. But in my lab, we focus on the brain, heart, and gut axis. And this is all relevant to my story and to lupus in a minute here. But I wanted to start there because that's where my career is. And in the middle of me, I was an epidemiologist I've been an epidemiologist since 2015. And I've been studying cannabis for longer. I've been studying cannabis for over 10 years. And it started because my father has an incurable disease. He has multiple incurable diseases, one of which is cancer. He also has scleroderma and common variable immunodeficiency disorder. So a lot of autoimmune conditions in my family. I don't know why, but I thought I was going to be one who was not going to be impacted by the autoimmune diseases. So I didn't really pay too much attention to it, to be honest. So here I am, faculty member at the University of Miami. I'm here teaching epidemiology. And what I noticed, I'm also an athlete. So I'm a triathlete. I compete, I run. This is all prior, I'm just painting a picture of what my life looked like. I started noticing that I was getting pains. It presented in my hands first. So I actually thought I had carpal tunnel. At least that's what the physicians were telling me. They're like, oh, calm down. You did too much research. That's why you're in pain. But it was just a lot. It was a lot of different symptoms that wasn't really adding up to me with hand pain. And then I also suffered a heart attack, a minor heart attack. And that's really what caught my attention because I was so young. And they were like, how can you have a heart attack at this time? Fast forward to the end of 2016 and 2017, that's when I was really getting a lot of physician care, trying to figure out what's wrong. At this point, I'm trying to paint the picture of what it looks like. So you see me now, this is me, doctor. This is not how I was like last year. And I say that jokingly, but it's not funny. About a year and a half ago, I was literally 240 pounds. I was sad. I was depressed. I was being pumped steroids. I was told that I needed to get on methotrexate or Plaquenil, and I was going to have to be taking versions of chemo to get my system together because I was diagnosed with lupus. And not only was I diagnosed with lupus, but I was diagnosed pretty young, and it was impacting my organs. And that's why I was having heart complications at the time. So for all the people in the audience, if you don't hear anything else that I say, if you know your body, and if you believe that you're not having panic attacks, because that's what everybody was telling me, all the physicians were like, oh, you have a high stress job, you're having a panic attack, relax, breathe. Oh, if one more person tells me to breathe, I was gonna have a real panic attack. No, but really, so luckily after a while I was diagnosed. And when I was diagnosed, immediately, there were no questions about my lifestyle. There was no questions about, my beliefs about anything. It was an immediate, these are the pills, this is the medication, this is the shot. Because they even, I don't have it with me, but I usually keep it, it's in my home office. In my desk area, I always keep the picture of the syringe of where I would be needed to take the shot so I could be reminded of what was going to be needed. So anyway, fast forward, after all these diseases, after all this medication they wanted me on, I was looking at the side effects because also as an epidemiologist, I want to know what are the potential implications of this. One of them was, not having children, further diseases, other things that could be going along. So of course, the pharmaceuticals was not one of my top choices. Fast forward to medicinal cannabis. One of the things that, first of all, just to let you know, as soon as I was diagnosed, I wasn't automatically, I'm going to heal myself with plants and everything's going to be fine. No, I was in denial. I was thinking about whether I was going to take this medication. And I did. I started with the steroids, and the steroids was actually making things worse for me. I was literally ballooning before my eyes. Like I thought I was going to pop, y'all. It was quite serious. And I was actually in more pain. My mental health was going was going south. So a lot to what Stanley was talking about before, mental health implications are also some of the side effects of having lupus or any of these autoimmune conditions. So what I started doing was I treated myself as my own test subject. I was like, all right, I need to get back to the basics. And that's when I started looking more into plants, more into non-pharmaceutical modalities to treat or manage some of my symptoms. So painting the picture back for you all, this is me. I would get out of bed and my hip would be in so much pain that I would literally fall. Like there was no running for me. I never thought I was going to run another half marathon. Let's just put it that way, or even run to my car. So, changing my lifestyle to be a vegan and using plants and incorporating medical cannabis in certain ways. So when we were mentioning topicals, smoking is not healthy. I'm a scientist and I'm looking at it. I have the data. Smoking is not great for everyone. But sometimes these topicals, so having a topical of CBD cream directly on my hip, was helpful. And again, this is literally the first time that I'm talking live about what I personally do. So I'm a little shaky. I don't get shaky during talks, but it's just like
you're doing great. You're doing great.
Seeing it real life is what caught it. And then the data was presenting with it. So anyway, that's a brief my story. I know we have lots of questions. I just wanted to say that.
Thank you so much.
Great information.
Yeah, thank you just for being vulnerable, coming here and speaking about your own personal journey. I don't think I've ever heard you speak publicly about it. And so I'm so grateful that you were able to share with our audience about everything that you've gone through. And you were perfect. Because these are the stories that we need to hear, that our listeners need to hear. Caregivers, people who are caring for someone with lupus, to understand that even though it's a silent disease, like you said, doesn't always appear physically. There's a lot of there's a lot of mental disability or mental affliction that happens while you're dealing with this type of diagnosis. And so it's so amazing. I wish we could show your before and after picture, where you were a year and a half ago and where you are today. And I wish we could see some of your Instagram feed too. So if you guys are not following Dr. Denise, she's Dr.Vadeau on Instagram, and you'll see that she did not take the advice of the doctors when they told her she couldn't stay in the sun.
I know that's right.
It would be debilitating. And so thank you so much for sharing your story. We really appreciate it. Stanley.
Dr. Denise, thank you so much for that information. And I know we've got some viewers. I tagged some people and I actually sent this video to some people. So if you're a patient, a caregiver, or a person that may be lupus curious because you're going through the process yourself, please be sure to chime in, ask questions, because today you have the ability to ask someone who's an expert in this field. She studies disease processes. So as when we introduced her, we said she's an epidemiologist. And I'm sure there are some people that probably looked around and was like, let me Google that. Disease processes and how they work with cannabis. So Dr. Denise Vadeau, what from your experience from being a clinician as well as a patient, where would you say we are here in America with Western medicine when it comes to the discussion of lupus and the introduction of medical cannabis as a potential alternative? Where are we in that spectrum of healthcare?
So as a scientist and a patient myself, I can say that we're very behind. Even other countries, if we're talking about the US in particular, we're pretty behind. I can attest that no rheumatologist has ever communicated with me about medical cannabis. And I don't go into my doctor's office, oh, I'm a cannabis epidemiologist, let's talk cannabis. No, I just hear what they say. And I have, just for disclosure, I've had at least 5 different rheumatologists in my journey, and never once has cannabis been something that has been discussed. My latest rheumatologist, I did bring it up, and it was a very, bad word. It was, we don't discuss, there's not enough evidence. We don't talk about that. The research hasn't been done. The problem is that I am a scientist and I'm very engaged with the research, and there is research. There is research out there. There's research that is showing how cannabis can impact inflammation, in particular through the endocannabinoid system on the organs, the same organs that are impacted by diseases like lupus.
So we need more discussions on it.
Basically, we definitely do. And we need more research that is disseminated for everyone. It's about access to information too, because I can conduct research every day here, but if I'm not publishing it or sharing it with the community, then what's the point? I'm really just like hoarding the information, and that's not great for the community at all.
I have a question, Dr. Denise, with the work that you're doing at the University of Miami, correct?
Correct.
Is there an opportunity for patients or for caregivers to get involved with what the research that you're doing? I know that you're researching specific diseases right now, probably COVID, the effects of cannabis and using COVID. But do you know of any, or are you aware of any research that's being done with lupus and cannabis?
That's a great question. Thank you, Nicole. Currently, I have a few studies ongoing. My main studies are on cardiovascular disease right now, and of course, COVID-19, HIV, and cancer. Those are the 4 that I'm studying actively. We are in the middle of designing a study for lupus right now based on preliminary evidence of past studies that we've conducted. So the next time we talk, I may have more information on that, actually, Nicole.
Oh, that's so exciting. That's fantastic. Yes. I think we have a question. Do we have a question from the audience? it sounds like she wants to know, because like I read earlier, we know that all autoimmune disorders have a debilitating chronic inflammation that happens to the body. Can you talk a little bit about how cannabis specifically helps with inflammation in the body, and how the ECS is works together with phytocannabinoids to help reduce that inflammation?
Oh yes, this is my favorite question. I wish I had my figure today to show and share the screen with you guys. But so the endocannabinoid system, for those of you who don't know, everyone has a system in our body. It's the endocannabinoid system. We're actually calling it the endocannabinoid. I'm working on how to pronounce it better.
Endocannabdome.
There you go.
Endocannabdome.
It keeps our body at homeostasis. And what the research is showing is that cannabinoid, first of all, we already have cannabinoids in our body. So when we have a deficiency of already available cannabinoids, that's when certain diseases can have a prime environment to actually proliferate. So by introducing phytocannabinoids, or cannabis from the plant itself, you can supplement your endocannabinoid system in a way that may help other processes. So in this case, we're talking about inflammation, and certain cannabinoids help then in certain organs better than others because of the receptors. So without getting too scientific with this conversation, cannabinoids can help with inflammation due to the endocannabinoid system and specific receptors, CB1 and CB2. There's a lot of data on what CBD does in particular to inflammation. So that's why it makes sense why it can impact diseases that have high inflammation. I'm looking at that, for example, in COVID. COVID right now, everyone has heard of COVID. If you've never heard of lupus, you've at least heard of COVID, right? COVID, one of the big things with COVID is this inflammation party that no one wants to go to, which is the cytokine storm. Cannabis has been shown to reduce inflammation. So in theory, it can reduce that inflammation party that's occurring within COVID patients. If you think about that in the context of lupus, it can be similar.
But let's be clear. Dr. Denise is not saying if you have COVID that you should smoke a joint. That's
clearly. Thank you, Nicole.
We are saying that cannabis has a lot of different modalities to be able to be used where you can get the most benefits medicinally from the plant. So one of the things that we learned about this virus, COVID in particular, early on, a year and a half ago, was that it doesn't like hot liquids, hot things, right? I remember, people telling, before we had a vaccine, everybody was saying, drink your hot teas and put your herbs in your teas. Well, your herb, the flower from the plant, this cannabis plant, is also an herb, just like your lavender and your chamomile and your green tea. Steep that in some warm water. I know I talked about it yesterday. It's just my favorite way to consume my medicine. I do it daily. And so that's another modality to getting the medicine in your body. Of course, you have concentrates, you have tinctures, you have topicals. There are so many other different ways. And for patients, for people who are really seeking relief, especially from inflammation that causes pain, try to stay away from your sugary edibles. That's another thing that I like to tell people, unless you're making your own edibles at home, which is quite possible, that's probably the safest way to consume if you're going to digest. If that's your favorite way and your favorite modality, it is okay to do, but just stay away from all the brownies and gummies and those kind of things. They can have negative adverse effects than what you're trying to get from the medication.
I have something I'd like to add to that. When it comes to the different modalities of administration, Dr. Vadeau, I know that there's so many ways to ingest, to apply, to even consume medical cannabis or cannabinoid-derived products. Well, oftentimes, the symptoms of lupus affect the body in so many different ways. What are your thoughts on suppositories for patients that may be having those systemic flare-ups that need that long-term relief versus something that's a quick fix or something that's a little bit more acute? Because I have experience with some of the suppository products, and I've found that they provide a long-term and a different type of relief. But what are your thoughts on patients who may be having flare-ups that last days, weeks, or even months with the administration of suppositories that are cannabis based?
Great question. And I'm so happy that we're talking about suppositories, because that is something that one of the routes that we very rarely discuss. And each route has a different time till onset. So we know that smoking and vaping, that's the immediate, as soon as you ingest, 5 to 10 minutes, you feel impact. And then edibles, it's different, suppositories as well. So regarding your exact question about how do I feel about that, I feel that more conversations need to occur about that. And that is something that I think research is there's a deficit in the research right now. Most of what I have is case reports from patients that we're seeing or participants in our studies, especially those who have gastrointestinal issues. They've been finding that the suppositories have been helpful. But yes, Stanley, to your question, I do highly encourage, based on the evidence that we've seen in our lab and some of the evidence that's been published, I do believe that suppositories is a good route for those of the patients who want to endorse medical cannabis use, especially for that long-term impact. Because again, smoking it, it goes through your body within like 2 to 4 hours. Edibles can last 8 to 10 hours, and suppositories, the evidence is still out there. So great question. And I encourage patients who are interested to look more into that and have conversations with your providers. Just because I'm a doctor, just because I'm a scientist, doesn't mean I know everything. Just because your physician is a physician, again, it doesn't mean they know everything. Come with questions. And if they don't want to answer questions, I don't know,
find a new physician. And the other question that came up on the screen, Dr. Vadeau, was about THC versus CBD. So they had a question about full spectrum versus isolate use. And could you get a little bit into why it is important to consider those as different options when you're looking for medications?
Yes, that's a great thing. First of all, not all cannabis is created equal. If I have not said that today, let me say it again. Not all cannabis is created equal. In our endocannabinoid system, the receptors engage with specific cannabinoids. We're still researching cannabinoids by the day. I don't know if you can see behind me, but there's a big poster and it has at least 100 different cannabinoids on there. So it's not just THC and CBD, but that's what's the most popular right now. It's important to know what's in your product because it really, especially depending on what ailment you may have. So in the case of lupus, for example, it also depends on if you have the systemic or the skin. There's layers to this, just like there's layers to cannabis use, right? So THC and certain cannabinoids, as I mentioned, bind with certain receptors. So THC, we know, binds with CB1 receptors, which are primarily located in the brain, for example. So when you are ingesting a product, for example, that is high THC, low CBD, then by scientific premise, we should expect that most of the impact is going to be with the CB1 receptors because there's more THC. That's why you get the quote unquote psychoactive impact, because the brain, CB1 receptors, THC. Now, with the CBD, that you don't necessarily feel it in your brain, but it does help with the inflammation. So to answer your question, when patients are looking at products, it's vital. If I say it again, it's vital to know what cannabinoids are there, because each cannabinoid's impact engage with different organs depending on the receptors. So if a patient does not want to feel the psychoactive impact, for example, then I would suggest not to get a THC including product. Now, we're not even talking about the legality. I'm just assuming that we're talking about legal states where they have access and things like that. But I do want to just preface here that there is data that suggests that certain ailments do benefit from a ratio of these cannabinoids. So we're no longer in the school of thought where an isolate, where only CBD by itself is the quote unquote perfect answer to everything. No, the plant itself has layers. It has other terpenes, other components that we haven't even talked about today. Mm-hmm. So I don't want to go too left with that conversation, but I just want to reiterate, not all cannabis is created equal, and the cannabinoids are vital when discussing what the health implications are going to be.
Absolutely.
So, ladies and gentlemen, for everyone watching, I know this is a lot of information. We've used a lot of acronyms, and some of this you may not understand. So I'm going to give you a quick analysis and a quick comparison. So what she was saying about the different cannabinoids and the receptors in our body. You remember when you're a child or you have children, you have the triangle, you put in the triangle hole, the circle in the circle hole, the star in the star hole. We have those same receptors in our body. So we have keys and we have keyholes. So certain cannabinoids can't feel certain receptors. And that is why the endocannabinoid system is so robust, ladies and gentlemen, because we have to understand that every cannabinoid is different. And when she was saying that you can't just take one type of product and think it's going to fix everything because there's layers, here's a correlation for you. Imagine your child falls and skins their knee. You don't just take a brand new Band-Aid and put it over the wound. You wash the wound. You may apply a gentle antiseptic to the wound. After that, you clean it with an antiseptic. After that, you may even apply some Neosporin and then put the bandage over it. So think of it as a layered process, ladies and gentlemen. And we're not here today to say that, hey, cannabis is going to fix all your lupus symptoms, because we have to understand that these disease processes in cannabis healthcare oftentimes takes a polypharmacy approach. And for those who may not know what that is, it means combining different medications to create a treatment regimen. So for some of these patients who only consume or use the products when they're in the midst of a flare-up, oftentimes they may need to create a daily dosage guide or a regimen to help them manage every single day.
And before we let the beautiful Dr. Denise go, I want to make sure that she can give us the information on how to get in contact with her for anyone in our audience that wants to reach out to her. She's on the verge of creating this new lupus study and research. So if we have any lupus caretakers or patients that are listening in today, you want to get connected with Dr. Denise and make sure that you can have an opportunity to be a part of this. So Dr. Denise, please let us know your information before we let you go.
Well, thank you for that. You can find me on, I'm probably the most active on Instagram at dr.vidot, Dr. Vadeau. You can also follow my labs there, Vadeau Cannabis Lab. But I would say that's the key. If you really want to have any questions, feel free to message me there. You can also email me. My email is dvadeau@miami.edu. But before I go, I just really want to reiterate the importance of this conversation and really thank you all for having it, even if I wasn't on it, because when I was diagnosed with lupus, I felt so alone. And I felt that me wanting to understand what cannabis could do for lupus, just based on my career, I felt that I didn't know where to go. So I'm glad to have this conversation, and just remember, not all cannabis is created equal.
And another thing I want to add as well, folks, that she said something very important when she was telling us about her story and how she transitioned from the lifestyle before she was diagnosed and the lifestyle after. And that was, she went plant-based, she went vegan. And that helped tremendously with her helping to manage her symptoms from her disease. So that's also another thing that you might want to take into consideration. If you want to add cannabis to your regimen to help manage the symptoms of lupus, you have to seriously consider what foods are you consuming that are making your flare-ups or making the symptoms from lupus worse. And considering a plant-based diet might be the right route for you as well. Dr. Denise Vadeau, thank you so very much. We really appreciate you taking the time to share your story with us. Keep on being the wonderful warrior that you are. Excited to do more work with you. You let us know how we can help amplify you. And we thank you so much. Thanks again.
Thank you. Have a great day, everyone.
Thanks for everything, Doctor.
Thank you.
All right, Stan. So we covered a lot with that conversation.
Yes.
We have
I want to get back to the question. So the question is, ladies and gentlemen, I think from Jennifer Whitstruck, I think I may have lupus, but I'm having difficulty getting my healthcare provider to work with me to figure out what's going on. So many, she put SX in acronym, maybe signs or symptoms, as well as I'm having some heart issues recently related, sudden onset of painful arthritis that's continuing to spread. It would be grateful to get to a point where I was using my energy on treating it.
Wow.
Well, Jennifer, that goes back to the original discussion that Nicole and I were having. It takes the average patient, oftentimes 3 to 7 years, and at least 5 different physicians to get a clear clinical diagnosis. You heard from Dr. Vadeau that it took her 5 specialists just to even get the right recommendations for her and her diagnosis. So sometimes it may even come down to changing your healthcare provider. Again, we have to be our own advocates, and we want to make sure that we tell people it's okay to get a second opinion, a third opinion, a fourth opinion. And back to Dr. Vadeau's previous comment regarding food and diet, because here at Minorities for Medical Marijuana, we always try to promote healthy living. Medical cannabis is not the end all be all, but what we talk about is dietary health, physical health, spiritual health, mental health, and even your social health. We've got one of our executive members, our chairman, Eric Range, who has hemp and fork. We talked yesterday about the antioxidants and that the nutritional value that hemp seeds produce. Because if we understand that lupus can be caused from outside environment or medications, it can also be helped mitigated with a proper, balanced, healthy diet and lifestyle. This does include drinking water. This includes getting out and exercising. Now, I know for patients during flare-ups, it can be their skin can be very photosensitive. So we want to be mindful of that. But at Minorities for Medical Marijuana, we want to try to provide you with information. We may not have all the answers. We may not know everything, but I promise you, if you reach out to us, reach out to Nicole, reach out to the M4MM main page. If we don't have the answers or have someone within our network with the answers, I assure you, we will help to try to get you those answers. And if we can't, then we'll be in this together. So Nicole, we talked about this color this morning. So for those who may not know, I've got my purple Jimi Hendrix shirt on today because the color for lupus awareness is purple.
That's right. That's right. And you can find me at Purple Plant Magic because I truly believe in, and my hair will always be adorned with that purple crown. But I just know that a lot of people out there are wondering, like our Jennifer that joined us. Thank you so much for sharing your story with us, Jennifer. I want you to know that, like Stanley said, we are patients. We are patients that are passionate about the work that we do. Stanley is a professional, a trained medic. We do this because we have love for our community. And so when we have people that reach out to us and they want to learn more, I want to make sure that we let you know what we have in our wheelhouse to help you. So one of the things based on my research and that you might want to write down, Jennifer, is that you need to ask your physician or doctor for an anti-nuclear antibody test. Based on the research that I found, this is short for ANA test. This will help determine, along with your symptoms, if you have lupus. And so anti-nuclear antibody test. Request that from your doctor, your physician, as soon as you can. Also, if like you said at the end of your statement, you're ready to move into treatment. And if that is the case, reach out to Dr. Denise, reach out to other lupus warriors out there that have been where you are. And if you need more help, you can find me at Purple Plant Magic. You can find Stanley at the Cannabis on Instagram. And the same for our websites, the Cannabis and Purple Plant Magic. Reach out to us. We want to give you as many resources as we can to help you along with this journey. And thank you again, everyone who joined us. Today's conversation has been so amazing. We here at the M4MM family welcome everyone. If you have any questions, any follow-up questions, you want to get more resources, we're here. Reach out to us. You can find Minorities for Medical Marijuana at m4mmunited.org. And you can find us on Instagram at the same, m4mmunited. Guys, thank you so much. Stanley, my co-host, thank you so much for doing this with me.
Before we get out of here, let's make sure we tell them that this Health is Wellness Week has been brought to you by Minorities for Medical Marijuana, Please tune in tomorrow as we continue this week. We'll be discussing rheumatoid arthritis. On Thursday, we'll be discussing multiple sclerosis, and we'll be closing out on Friday with fibromyalgia. So be sure to follow the M4MM United Facebook page, YouTube page, and LinkedIn. Don't forget to set your alerts and click subscribe, because we're going to keep the great information coming. Thank you all for joining us, and I hope you all have a great day.
Thank you. Thanks, everybody. See y'all soon. See you tomorrow, 9 a.m. Pacific, 12 p.m. Eastern. Thanks again, guys.